Hi everybody, it's Adam with HeartValveSurgery.com, and we are at the Mitral Conclave in New York City. I am thrilled to be joined by Dr. Rob Smith, who is the chair of cardiac surgery at Baylor Scott White, the heart hospital in Plano, Texas. Dr. Smith, it is great to see you again.
Yeah, great to see you, Adam.
Yeah, Dr. Smith, you and I have known each other for a long time. We're at the Mitral Conclave, seeing these great presentations, and we've gotten some patient questions while we're here. I was curious to know if you can answer Alexandra's question. She asks, all the data I've seen measures outcomes from mitral valve repair alone. Have you seen any data on survival and durability rates for patients who undergo both mitral and tricuspid valve repair surgery?
So Alexandra, it's a really good question, and I wish I had some really easy to sum up one kind of line answer. Unfortunately, like so many things, probably every time you go to your doctor's office, you get kind of this really long-winded answer. I'm going to give you a long-winded answer, so I'm sorry. So the first part about this, Alexandra, is we've taken now simple isolated mitral valve surgery, which is not simple, as you already know, and now we've confounded it with this other piece, which is tricuspid valve surgery. And tricuspid valve surgery, when it's undertaken for patients with anything from a mild amount of regurgitation, but a big dilated valve, to really bad tricuspid valve insufficiency. And it really depends for your particular issue, which one of those, kind of pieces you had, how did you originally present, what was the treatment, what was the result, and that gives us a lot more to talk about on what's the expectation. But first off, and most importantly, when we're talking about degenerative mitral valve disease, Adam, and for the rest of the folks out there, is that's really the key component to this. It's not the tricuspid valve. In fact, in most of those instances, we think the tricuspid valve is really kind of a consequence of the original problem, which is the mitral valve. So number one, if you had a great mitral valve repair, awesome, and I'm excited for you, and that's really the first piece we need to focus on. The second thing is if you had severe regurgitation. So what's your risk of recurrence? Well, the risk of recurrence is probably anywhere from about 2% to 50%. And why so big? Because one, we don't know all the factors that go into why that reoccurs. So number one, if you had atrial fibrillation, if it's treated and you don't have it coming back, probably a less likelihood that you're going to have an issue with it. If you have hypertension and all these kind of downstream problems that can go along with just life, that starts to increase those risks over time. Unfortunately, again, the tricuspid valve alone is not something we have some great amount of data on. And so we're learning and we're trying to get back to you with all the information that we possibly can, but I don't have all those specific answers. I will say that, is there a risk of mortality with any of these things that we do as far as if they come back and they recur? Yes, there is. Are you dramatically at an improved chance for a very long, healthy, happy lifestyle? Absolutely, as a result of getting your surgery and having your mitral valve addressed. I want to let you know also we're constantly and continually working on trying to answer these things so that you providing these kind of questions are setting up the stages for the next kind of trials that we're looking at. So thank you.
Well, Alexandra, I hope that helped you learn more about your question and get an answer, even though it wasn't a specific answer. And Dr. Smith, on behalf of all the patients at HeartValveSurgery.com, patients all over the world, thanks for everything that you and your team are doing at Baylor Scott White, the Heart Hospital, Plano. Thanks so much for being with me today.
Thanks, Adam. Appreciate it.
Hi everybody, it's Adam. I hope you enjoyed that video. And don't forget, you can always subscribe to our YouTube channel. Watch the next 2 educational videos coming up on your screen, or click the blue button to visit HeartValveSurgery.com.